Lung cancer, or tumors originating in the lung, is one of the leading causes of cancer related to deaths globally. As the number of mortality keeps rising in Kenya, lung cancer continues to be referred to as a silent killer. This is because it is difficult to detect, treat, or even cure. Poisonous residue from smoking, asbestos, carcinogenic substances, and even environmental hazards have been singled out as major risk factors contributing directly or indirectly to lung cancer. However, the case studies that we have interacted with for the period of 2 months cast a shadow of uncertainty over what really causes cancer. Nimrod Tabu has more.
Dandora dumping site, and here smoke billows from the garbage and filth that has been continuously dumped here for decades. Those involved in transporting garbage here, as well as those who sort it on the ground, have little or no protective gear. They eat, sleep, work on the smoke pits, exposing themselves to respiratory complications like tuberculosis, pneumonia, and even lung cancer. Kehpca slums, the biggest in East Africa, and here the city dwellers are exposed to smoke on a daily basis because of using firewood and charcoal to prepare meals and even warm their homes, which are mostly made of tin and iron sheets.
The fact that lung cancer had always been associated with smoking is another issue why people tend to be misdiagnosed or get their diagnosis late, because if you're not smoking, then it's not something that I'll think of, up front. But I think for this, I think even with the other cancers, we need to start looking at the environment. What are the environmental triggers which are causing these conditions?
The dramatic rise in lung cancer is primarily attributed to smoking. But meet Dr. Dorcas Nyokangi.
You are growing up, you don't want to take or do anything next to drugs.
A scholar from the county of Kisii, she has never been a smoker.
That's what the doctors were wondering, how come? Because I had not even lived with anyone who smokes. But finally they suspected. We had lived in London for 5 years and they suspected the pollution.
It tends to be a silent cancer because there is a high burden of lung cancer, yes. But the issue with lung cancer is, unfortunately, it has a very high mortality rate. So the majority of people diagnosed with lung cancer will die within a fairly short period of time, especially if they're not able to access treatment and care.
Dr. Nyokangi was informed of her lung cancer by a radiologist. That was in 2012.
And they said, Mama, they have never seen this growth on your lung. I said, no. What growth? Said, you have a growth. I was shocking, Nimrod. I was shaken. So he had to help me, walk with me to the doctor's office. And I was shaking.
Frightened by the prospect of death, especially outside her home country, Kenya, she returned home to work as a lecturer at the Egerton University.
Cancer is a thief, it's a monster, because it stole my everything, first of all. I had a career, I wanted to teach and I love teaching, but I had to stop. I took early retirement in 2023 because I became so weak. I could not, go lecture 2-3 hours, sit mark.
In her illness, she turned to writing a book.
I lost one of my cancer warriors from Homa Bay who had lung cancer. And they were able to discover when it was in stage 4. And they could not assist her. She went through chemo. I think 4 of them, but she didn't manage. She passed on last month. Before I wrote this book, I was so sick, so weak, I didn't know I could make it. Then one night, as I was sleeping and seeing people in graves underneath, there was water, I could see my mom who had passed and many. A voice came to me that you will survive. I said, survive? Then I think I had gone deep end of denial.
At the Living Room International Hospital in the outskirts of Eldoret town, I meet 35-year-old Dorcas Atieno from Busia, a lung cancer patient. It all started with a misdiagnosis, with medics telling her that she was suffering from either tuberculosis, chronic pneumonia or HIV.
Nilianza kuugua mwaka wa 2014. Hapo ndo nilianza kukohoa damu. Nilipoenda kwa kituo cha afya, walinipima ugonjwa wa TB na HIV ambayo ilikosekana. Alafu ilipokosekana, niliwekwa katika madawa ya allergy, Centrism. Nilianza kuitumia hadi mwaka wa 2021.
Like Dr. Doris, Dorcas has never smoked cigarettes.
Jibu ilikuja, ikapatikana kumbe ni cancer of the lung, stage 3. Ndio nikawekwa kwa madawa sasa. Nikaambiwa sasa, hii kansa yangu sio ile ya kusambaa, ya kwenda kwa sehemu zingine, iko tu pale pale. Sasa nikaambiwa nitawekwa kimo round 6, isipopunguka nitaenda radio. After radio ndo wataona kama naweza fanyiwa surgery.
Dorcas is now under the care of family members. The Social Healthcare Insurance Fund has helped, but constant downtime of the system is a hindrance.
Unaweza pata hospitali umesema unakuja siku 2. Unapata na spend huko siku 4, siku 5. Sababu system unapata zimefail, ziko down.
In Nyeri, John Mbai and Edward Ngari have had a fair share of their battle with lung cancer. Mbai was a heavy smoker, but Edward Ngari never smoked. Apart from smoking, Mbai also used to carry out manual jobs at a quarry, exposing him to fine dust.
Nikasikia kuna uchungu inaenda hivi. Sasa nikarudi hospitali, nikawaambia kuna kitu baya kwa pande yangu ya roho. Sasa nikaambiwa nitatolewa hiyo uvimbe, itatolewa. Sasa nikatuma kwa kwa machini ya niende nitolewe. Sasa nienda nikatolewa. Kutolewa nikapewa nilipeleke huko Aga Khan. Labu kachukuliwa nini. Kaipeleka ndio nilipatikana niko na cancer.
Lifestyle, yes, has huge association with the kind of, conditions and diseases that we see. And that said, then it becomes a responsibility of everyone to take charge of their lives, so that we control and take charge in terms of, do we exercise, do we feed healthy. Again, it's not only just me as an individual, it's cross-cutting.
Edward Ngari is a man grounded quite literally by the disease.
Kwa ajili ya bill nikahamishwa mpaka Murang'a level 5 hospital. Hapo baada ya siku 4 madaktari wakagoma, nikarudi nyumbani. Kurudi nyumbani nikazindiwa.
Unable to afford treatment and medication, Ngari was given this wooden structure by his neighbor to live in. It is the only place that has electricity, which keeps his oxygen concentrator running.
Mahali naishi hakuna stima. Kwa bahati nzuri nikapata jirani mwema akanipatia chumba kidogo. Sasa hapo ndipo naendelea na matibabu yangu na hiyo oxygen concentrator yangu.
His family has found it difficult to provide home-based care for him. The 2 nurses who bath him and feed him have not been paid and are about to down their tools.
Sasa kwa wiki tunawapea kitu kidogo. Kila mtu tunampeaga 1,500 Na sasa kwa wakati huu tuko na masida juu tuko na wiki kadhaa hatuja walipa, karibu waachane na hii mzigo.
So Jana today has been...
Mama Josephine Kiprono is 69 years old today. She has become frail but battling on.
Nilikuwa nasikia sikutaka kukula, nasikia sina hamu ya kukula. Asante. Maumivu nilikuwa nasikia maumivu, alafu nikasikia uchovu.
After doing the CT scans, they discovered that there was a lump in the lung. So the doctor recommended that we go for test for cancer. They did the biopsy, and the results of biopsy tested to be positive. It was a lung cancer. So the doctor recommended that we do the staging. We do the staging, which it was at stage 4.
According to her family members, Mama Josephine was exposed to smoke after many years of cooking using firewood and charcoal.
So by the time you're actually being seen by either a medical officer or a specialist now like an oncologist, it's way down the line. So you'll find that during that time, this cancer will have progressed. And that is why I think, maybe that's why most people would not think of lung cancer just because you have a prolonged cough.
Lung cancer is one of those cancers, amongst many, that has very poor, we call it in medical terms, poor prognosis, or else it leads to death easily. It is actually, when you look at statistics, the amount of time that a patient stays with lung cancer is much shorter compared to other cancers.
Mama Josephine is likely to undergo radiotherapy and later surgery, but doctors at Living Room Hospital continue to watch her prognosis closely.
The ones who have lung cancer are like 4 to 5 in a day. So they are majorly inpatient and outpatient in general. So most of them, they come in the palliative or end of life stage.
So in other words, they present...
late. Those who we capture them at around stage 2, 3, then most of them are at stage 4.
At the Uasin Gishu County Government Headquarters, the county executive member in charge of health and his team of doctors, health providers and nurses are a worried lot.
Clearly, the reported cases in Uasin Gishu are worrying of the cancer cases and more especially the lung cancer cases. The question is, what would be the causing agents for these lung cancer cases? Could it be the chemicals that these citizens are exposed to?
Uasin Gishu is Kenya's leading food basket. Every year, millions of gallons of chemicals are either sprayed, poured, and even dropped from the air to combat crop diseases and pests. Could these chemicals be a leading cause of the rising cases of lung cancer?
And so the lung cancer cases are mainly farmers. So that we, as a Department of Health, we cannot pinpoint critically to say that these are caused by these chemicals that farmers use.
The index of suspicion for lung cancer in frontline healthcare workers is very, very low. It is something that we're trying to build up this capacity to ensure that every other time a patient comes and they are being treated for a respiratory tract infection, if the treatment does not respond to the empirical treatment or the medication, then it is very, very important for you to think what else could it be.
We visited a center in Eldoret that offers ultrasound and CT scan services. Madeline Wanja, a researcher with Empath, an organization that works closely with cancer patients, has volunteered to be our case study today. She goes through the first stage of registration at RadioCare. Any patient who comes here requiring services must be referred by his or her own physician.
The procedure itself entails giving a local anesthesia. There will be a consent. There will be the procedure will be done. The patient is actually awake through the procedure, so you're able to converse with the patient, and she's able to give you the feedback of what they are feeling, if there's any pain or anything else that they're feeling.
Inside the procedure room, Doctors Cornelius Kipchirchir and Daniel Chepsirop took us through the elaborate procedures.
So once we have the sample, we send them to our pathologist, and then they will send us back the results. And and then the patient will come and pick the results. When they come and pick the results, we discuss with them. We just don't give them the results and they go. We take time, we explain to them that the procedure that we did, that lump or that mass that was in your chest is actually probably cancerous, and the type is this much, is this type. And after that, now we tell them what they are supposed to go next.
Even during the investigative process, like CT scan of the chest, chest X-ray, or any other imaging of the chest, you'll find that tuberculosis and lung cancer present the same way, either starting as a nodule or progressively to be a mass. Even at that moment, most of the clinicians are in a dilemma, and that's when they send patients to interventional radiologists to determine what kind of a nodule or a mass it is.
Patrick Ndungu is 54 years old. For him, what started as a normal cough ended up being something serious.
Wale madaktari walikuwa wamekuja wakaniambia, sasa tunataka tukutoe maji na tutoe kwa mapafu yako kanyama kidogo, tuende tuangalie shida yako iko wapi. Na kwa sababu nilikuwa natafuta matibabu, nikawaambia ni sawa. Nikaenda kwa Dr. Wada. Sasa yeye ndiye break news. Ugonjwa wangu uko wapi? Kaniambia niko na uvimbe kwa lungs na ni cancerous. Tukaongea akaniambia usiwe na wasiwasi, si baya, inaweza tibika.
His current dilemma has been compounded by the fact that his body, especially the area around the heart, has been accumulating fluids. In February this year, at least 5 liters of fluid was drained through his arm. This has made it difficult for him to receive chemotherapy. He says his medication costs 700,000 shillings a month. A private organization has been willing to meet a bigger portion of his expenses to the tune of 670,000 shillings, allowing him to only pay 30,000 shillings.
Lakini kugepatikana msaada wa kujua kwa mapema ni shida gani uko nayo. Mtu haisumia sana. Shida ni kutafuta shida iko wapi. Tangu 2023 nimejua shida yangu November 2024.
But the good thing is, where there is consistency, many times patients will report improvement of quality of life. And we've seen this where we have cancer centers up and running with integrated palliative care services. Patient outcomes are very fulfilling. I'm sure you've seen patients smile and say thank you because of the care given.
Palliative care per se is supposed to be initiated upon diagnosis for everyone. And palliative care is not just the care that is targeting cancer patients. Even patients with other non-communicable diseases need palliative care. But in cancer, when you discuss palliative care, especially when there is a component of end-of-life care, a lot of patients don't embrace it. Why? Because there's a notion that once you begin to get through palliative care and end-of-life care, then you've lost hope.
When you check the audit few years down the line, how much went to the specific aspect about care and more specifically cancer care? It's very little. The commitment and the goodwill to do what we need to do is something that as CSOs we continue to talk about. And it's not about us, it's about the patient. When the patient is not able to receive that direct care that that patient needs at that point, it's a mess for our country. We are doing disservice to that patient.
As efforts to establish what really causes lung cancer continues, experts are urging the society to be on the lookout for continuous cough and abnormal chest pains. It is said that coughing is present in at least 50 to 75% of patients with lung cancer. Persistent coughs are therefore regarded as an early warning. Nimrod Tabu, Citizen TV.